So in determining who's a good candidate for radical prostatectomy, there are two fundamental issues to consider. One is the patient and their overall health and their life expectancy. And then we have to evaluate the cancer. And is this a cancer that's likely to cause a problem? And is this a cancer that we're likely to cure and reverse the consequences of the disease? So generally speaking, an ideal candidate is a gentleman who has at least a 10-year life expectancy. Now, in some cases where you have a very, very aggressive cancer, then a life expectancy less than 10 years, prostate surgery may in fact be indicated. But for the typical patient who comes in with a Gleason 6 cancer, a relatively small volume, less than 10 years, probably the cancer will do no harm. And so we don't want to do any harm by doing what we would call an unnecessary surgical procedure. So you really want to have a 10-year life expectancy. You also want to have a patient who doesn't have what we call significant comorbidities. So if someone has very severe vascular disease, has had several heart attacks, this patient poses a surgical risk. So even the most technically accomplished surgeon is going to encounter problems simply because of the patient's underlying medical condition. So healthy gentlemen will typically have a 10-year life expectancy, and that's a good benchmark. Now, as far as the cancer, we want to have a good chance that we're going to cure this cancer. So if you have a patient who has a very, very high PSA, or when you feel the prostate and the cancer is clearly outside of the gland, or you have very high Gleason scores of 9, and sometimes you have the combination. So you have a high PSA and a high Gleason score. We sometimes just have to say, you know what, the chances of helping this man is so low. It's so unlikely I'm going to cure the cancer. And what this man will be left with is simply the complications of the treatment. So we look at the life expectancy. We look at the likelihood the cancer is going to cause consequences. We look at the likelihood that by curing the cancer, we're going to impact in survival. And that's how I determine who's a good candidate for the radical prostatectomy.